As you can see, we have a problem with gravity. The face is sagging vertically. You see, we could do easily a facelift. So in terms of volume, of course, she lost volume. She's lost volume in the mid-face, in the chin area. But what are we doing with this part? Okay, we can't put filler here. We're not going to put filler in the malar area, in the parotid area. So we're in trouble. And here is very saggy also, and the neck also. So technically, what I'm going to try to do for you today is to try to have a vertical vector using dissolvable threads. These threads are mounted with little cones which are gripping the skin. This is a drawing I've created for this patient. It's going to be a 1, 2, 3, 4, 5 vectors with the same thread. I'm going to try to have a vertical ascension of the face like this, and then I will adjust the volume. So that's the game. Of course, we're going to feel the volume around the mouth. In the chin area, we're going to do the lower lip, which is backward, and maybe if we have time, and I don't know, maybe we'll do something on the neck. I'm not sure yet. Now, I just did the local anesthesia. So all along these lines, I've injected some xylocaine and epinephrine, 2%. So it's all fine. Of course, I can show you with the pencil how I'm going to draw the volume with the filler after. As usual, classic drawing goes like this, as you know, like this, like this. Okay, and we have a major work to do here, because this lovely lady, she had fat injection in this chin area, and obviously she said it didn't last. How long ago was it?
12.
12 what?
2019.
12 years ago?
No,
12 months. 2 years ago.
3 years ago.
3 years ago. Okay. 3 years ago, she had fat injected here, and it obviously didn't last. So then we'll have to do some work here. So I'm going to start with the thread. It's a bit maybe unusual for some of you. It's totally different that we do with the filler, but it's something you should see. I think it's interesting. For it opened the door for the future, for all of you. I'm not working for any threads company or whatsoever. I just want to share with you the progress. And the idea is, as usual, to postpone need of surgery, because some patients will never want surgery. So we need to help them and find a solution for them. So I think we're going to try. I'm doing the cheeks, okay, with Ultimate.
Yes.
She's very gaunt, as you can see, because even with Ultimate, I'm not sure one syringe will be sufficient for the mid-face. See? I can imagine 1 minute that anyone who is not at least, not even a doctor, someone with some skills. Usually, that's what I say when I do this sort of, I give advice for people who want to do the thread. I think the best training is how to use a cannula, because that gives you the depth, the sense of depth, the skills. You'll see when I'll go with a needle, you will understand exactly what I mean. I think if you have never injected with a cannula, you'll be already quite... you'll feel very uncomfortable, I think.
So you think if you are used in the handling of cannula, you can as well
Yes, I think this is the best training yes, I think it's the best training, because you are passing the needle at exactly the same depth you are doing with the cannula.
Okay.
So if, I mean, you're kind of virgin, you never use a cannula, you'll be paralyzed. I mean, oh, that's very nice. That's very nice for one. So I can work here. Keep your chin up. Voilà. Still doing my fillers. Case? I don't know.
No, not the books.
Not
The
the books.
cadavers.
Yeah,
The
yeah,
cadavers.
yeah, me too. I've been on surgery many years. For
Yes, I
25
know.
years, I've done surgery,
Yes,
you
I
know.
know.
I don't know. Maybe. Maybe.
I have another question.
Attends. Give me a swab. Give me a swab.
What do you think how many packages you need for the whole treatment?
Which treatment?
The whole treatment you are doing now, full face. How many packages of?
Of what? Threads or fillers?
Yeah.
Threads?
What? Yes. What you?
One pair at the moment. I'm going to use one. Okay. I pass the needle gently. Okay. See that?
Aber wieso geht er da nochmal hoch? Der hat ja keine Chromis mehr.
The cones are going to maintain the tension. The skin crimp you see here, all this skin gathering will disappear very quickly in the next couple of hours. I show you if we see this lady tomorrow, if you have a picture in the next few days, you will see. Usually we, no, the pink. No, the purple, sorry. Okay, and I'm going to lift my other vector. Okay, that's it. You see, with one thread, I've created 1, 2, 3, 4 vectors. Get my thread. You see the tension I have? Okay. The main indication of this thread is not to lift the muscle. Once again, we respect the anatomy. This is only to pull the skin and not the muscle.
Yeah, here you are above. You are in the fat, no?
No?
Under
Yeah,
the skin.
subcutaneous. I'm just subcutaneous, yes. But I'm gripping
Subcutaneous.
the skin. That's what I'm doing. I'm gripping the skin, nothing else.
Okay.
I don't try to grip the muscle.
No, that's
No, just
okay.
to tell you, because you don't really see. I'm going to show you. Let's have attends. Just sit up a bit. Alors, this is not a problem at all. Okay, this will disappear very quickly in the next maximum 48 hours, but usually after a few hours of ice pack. It's fine. The optimum result you achieve with thread will take 3 weeks. The final result will be in 3 weeks. You'll have the maximum tension. And after between 3 weeks and 3 months, you're going to have some scar tissue rolling around the thread. So, as I said, there was always 2 steps, 3 weeks, 3 months. You can see the difference.
Can you
Quite nice.
turn the head a little bit to the right side? So, yes, that we can see it. Okay, yeah.
Okay, here. Sorry, excuse me, I don't know where I am.
Yes, we can see the difference.
Pardon, excuse me. You see? I could take, normally I should put another thread here on the neck. Here it's a bit swollen because I put the anesthetic also. Don't forget I put some anesthetic before we start the session. So it's also you have some xylocaine and epinephrine, we make it a bit swollen. Okay. I haven't finished the work because now I need to work in the chin area. I'm going to do the job on the other side. I'm going to start with the thread this time and then I put fillers. So just to show you, you can do one way or the other way around. It's not a problem. I make mini incision with a no-core needle. I prefer to have space to pass the thread because sometimes if your hole is too narrow, swap, you can break your thread. That's happened quite a lot. They're quite fragile, these threads, in fact. I tried to get the longest vector to start with. I found some pink needle, 50 millimeter long, because classically they are 40 millimeter long. This 50 makes it easier for me. I have a much better vertical vector. Past my need. Stop shaking. Okay. I have such a good light. You see the depth is exactly like the cannula. Not too deep, not too superficial. Certainly not too superficial because you can have the main side effect you can have with these cones is if you are too superficial because you're frightened, and then the cone will definitely irritate the skin and you'll have a major inflammation which is very difficult to get rid of. So the depth is very important. But as I told you, the best depth is the one you use with the cannula to inject some classic Teosyal product. Give me the purple needle. I have to enlarge my holes. If not, I cannot pass it again. They will break. It's difficult. I don't have a good light. I can't really see what I'm doing here now.
Yeah, don't ask.
Okay. It's better now. Keep it close. You see, I finished with a vertical vector, which helped me to lift that, which is very difficult. Because when you put too much filler in this area, as you know, you can make it heavier, especially if the muscle underneath is loose. So, see, up, I go in a nasolabial fold, create a nice tension. You see I have the tension, right? Yeah, purple, purple. And now you see I have a good tension. I can cut my thread here. I can still finish with another vertical oblique vector. Because I can see, I still have another cone. Sorry. Okay. I can cut. See, the procedure is quite simple, in fact. Okay. I didn't really interfere with my filling area, which I'm going to deal with now.
So it looks very easy, eh?
Yeah, it looks. Quite interesting. Now I'm going to just touch, please. I'm going to feel. You see the difference when it's filled and not filled, when it's pulled on both sides. You see this side is pulled, but not filled. See, I give you all the different variations. Then you can you see by yourself. Sorry. You see, voilà. This with filler, filler and threads. Excuse me. Threads and no fillers. Okay, now we have to lift. Okay. Avoiding the eye socket area like this morning. Here, not too much here, stopping here. Okay, here. I didn't give her any dental block, just I made a very light local anesthetic along the line which I drew for my thread. The rest is not numb. You see, I can go here and feel the nasolabial fold in the same time, which I like to do it in this, with this sort of vector. What you see is a bit of some avant-garde combining two procedures like that. I don't think you saw that before. It's quite new. Even for the threads company, they never did it before. Okay. Okay, it's quite easy. Same thing. Open your mouth. I check. I spread. Can you see? Okay. Now I have to work in this area, which is really damaged around the chin area. It's really bad. I'm going to do ultimate also for this area, but you have a severe retraction here. I don't know why. Okay. Tia, hold that please for me. Okay. Voilà. Open your mouth, please. Voilà, if you open the mouth, it's much better sometimes because if not, you lose a sense of depth sometimes. And here is could be embarrassing. So you have a better view when you ask the patient to open the mouth. You have much better control on what you're doing. It's very, very deep. Okay, let's do the other side. Okay, keep the mouth open. Yes, you can see it's much better. Close your mouth. You see, you can die very easily if the mouth closed. You don't really know where you are. Open your mouth. It's much better. You see the tip of your cannula. You have a much better control on what you're doing. Close. Start looking. Let's see. I think maybe she needs more. Can you sit up, please? Let's have a look. It's getting better. It's still a bit deep. It's very deep, huh? I understand why even with fat it didn't last. I need a guide here. I just want to put it here. Still here. Open your mouth. Open your mouth. You see, I put my finger inside because I can feel. I don't want her to have lumps inside the mouth. She will feel it immediately. So I put my finger inside. I can control. I have the feeling of my cannula going through. I have the sense of depth, which I lose if I don't put my finger. Open your mouth. See? That allows me to readjust. I was too deep. Now I come much more superficial. You see my cannula becomes much more visible now. So I do like a second layer, a second plan, more superficial. It's unbelievable. She absorbed the filler. I don't know where the filler is going. It's like a... Okay, close your mouth. Perfect. For Christmas, because she's going to look 10 years younger. Okay. Same thing. If you look inside, you see there's no bubble, there's nothing. I don't know if you can see inside, but see, there's no lump, there's nothing. Okay, no bruise, no lump, nothing. It's perfectly in the plan. If I put my fingers, it's all even. Here it's a bit lumpy here. And if you feel something a bit lumpy, you press on it. Okay. In the meantime, you see the tension on my thread is relaxing.
Yeah, we can see this.
You see, and I didn't put ice pack. If you put ice pack, after half an hour, you hardly see anything. Let's work around the lips, definitely the lower lip. I push it down like this. So, I don't want to do the outline. I want to create volume on this lower lip. I start from the center with one dot. I'm going to try to achieve as much as possible. The less entrance dots, the better. Smile. See? One dot.
Two.
Rejuvenate a bit the upper lip too.
This is RHA2, yes?
Yes.
Yeah. 0.5 it was, huh? About the dot on the...
Absolutely.
Absolutely, thank you.
Yes, 0.5.
Sehr schön, ja gleich. Ja.
This is very precise, and you need good light usually to catch up the... Need a smile. I need a bit more here.
And compared to an operative intervention, the costs are the same.
No.
Or you have less.
Look at the bleaching first. Because the cost, it depends how many syringes we use and how many threads. The thread, at the moment, we use only one thread. It's quite cheap, one thread. One thread means one pair. This is not expensive.
Okay.
One pair is not expensive at all. If you put 4 or 5, that's different. But
So the costs will be the filler procedure plus the threads.
the cost is
which-
less, but it's not the problem. The problem here, we're not budgeting things here. We try to move forward and to show people that we can do a lot of things in terms of non-cosmetic, in terms of non-surgical. Okay, we try to.
Yeah.
We still are doing cosmetic medical procedures here, and most of the doctors here, and we try to push our limits, to push our frontier, how far we can go, not using the knife. That's the main point at the moment. That's why we try to show. Then, cost-wise, it's cheaper, of course, but this lovely lady, she's also free to have a surgery if she wants. She could have the surgery, definitely. She was a good case for surgery, but maybe she doesn't want surgery. I don't think it's only always a budget problem, a money issue, because if you make a poll, you will see that 60, 70% of the women will never have surgery, whatever they have the means to do it or not. So what are you doing with these people? You have to help them. So you have to improve. That's why I'm showing you all this combination of techniques, because you have to go further. You have to improve the result as far as possible. That's it. Now, of course, this lady is coming, but you can start earlier on and prevent. She passed the prevention time, this lady, okay? She definitely needed a sort of facelift. She even had fat injection, which didn't work on her. So, but let's say if you start combining your fillers and your threads around 40, 45, that's more interesting. You will prevent, you will postpone, you will stop. You see, it depends.
So as it is a semi-sterile procedure, do you give your patient
Antibiotics, yes.
antibiotics?
Absolutely.
How long?
3 days.
3 days, okay.
Just give me the one again, please. I'll try to feel. She has very difficult lines, like tattoos, you know. It's very difficult to feel them. I don't have the right light. Okay. It's already better.
It's getting better now, huh?
It's getting better. Huh? Not bad, huh? Interesting. Interesting. You can see that she will have no downtime. Okay, if you compare with the surgery, also it's a different concept. She can, if she works, she can go back to work tomorrow. She will have no issues, no problem. Okay. It's a good example of what you can achieve with a patient. I didn't bruise her. Now she needs to have ice pack technically. And if you see her in 1 hour after the ice pack, she looks great. You see, you can combine. That shows you threads. You can combine the procedures. I show you I put the threads first and then the fillers first. Doesn't really matter. I think it's fine.
Thank you very much.